I am Dr. Alanna Rinas. I'm a naturopathic at Integrated Health Clinic. My practice mainly revolves around women's health, integrative cancer care, and I also do some medical aesthetics. Ultimately, we should care about blood sugar even if we don't have diabetes, because we don't want to get diabetes. Blood sugar is also intimately involved in how we feel every day. So good, stable, steady blood sugar is really important for having that energy that keeps us going, helps prevent that kind of afternoon crash, keeps us from being hangry. Blood sugar is really important when we're thinking about weight loss and weight management and prevention of all different types of other chronic diseases. So diabetes, or type 2 diabetes and pre-diabetes, are really conditions or diseases of lifestyle, and this is where naturopathic medicine thrives. These are conditions where the patient or the individual has so much control over the progression of the disease, and doing things like having the right diet, incorporating lifestyle measures, exercising properly, go a long way in not only the prevention but also the treatment and management of these conditions. So weight loss is so much more than just calories in and calories out. We want to think about how our hormones are also affecting not only our food choices but fat storing and fat loss, and blood sugar and subsequently insulin play a really big role here. When we eat, what happens, and our body releases insulin. This is a normal physiologic process, and that insulin is what's called an anabolic hormone. So anabolic hormone means that it sends signals for growth and storage. So we can imagine in the context of weight loss and weight management, we want to make sure that these signals from insulin are really well controlled. The other piece of this is that when we have elevated insulin or chronically elevated insulin, and we're always getting these signals for fat storage, we're also missing out on those signals for fat breakdown. So it's kind of a double-edged sword. So a continuous glucose monitor is a small device, typically worn on the back of the arm, that allows the user to measure their sugars at any time just with the use of a smartphone. So this is revolutionary for people with type 2 diabetes who are trying to better manage their condition, but also I think is really interesting for people with pre-diabetes or insulin resistant, people that are trying to lose weight, because as opposed to having to use a finger prick to measure blood sugar, which is not only painful but cumbersome, you can just scan at any time and have your sugar readings. These devices are not permanent. They're good for about 14 days, but it really allows you to see in real time how the food you're eating is affecting your metabolic health. So one of the reasons that women especially should care about blood sugar and insulin is because this is a relationship that changes throughout our life, especially through perimenopause and menopause. Estrogen is a major insulin sensitizer, meaning that it makes our bodies more responsive to insulin. So as we go through perimenopause and subsequently menopause, when our estrogen really starts to fall off the map, we require more insulin to be released in response to the same amount of carbohydrate, because we don't have the same amount of estrogen that we once had. So a common complaint I hear through perimenopause and menopause is that I'm eating the same, I'm exercising the same, and I'm still gaining weight. And so this relationship between estrogen and insulin is one that we really have to take into account when we're talking about weight management through menopause. If this is a topic that interests you, I would love to discuss it more. Blood sugar is one of my favorite things. So you can book an appointment through Integrated Health Clinic, and I can't wait to see you.